And today I'll be presenting on my supplement regulation plan proposal. So first, what are dietary supplements? So according to the U.S. Food and Drug Administration, FDA, dietary supplements are intended to add or supplement the diet, but not to actually replace it. Dietary supplements come in a variety of forms. They can come in a pill, and they can come powders, or even liquids that can be added in teas, and they contain ingredients such as vitamins, minerals, botanicals and herbs, and amino acids. And these dietary supplements are designed to be able to complement one's diet, but as I mentioned, not actually replace it. There are some benefits when it comes to dietary supplements. Dietary supplements can actually help improve or maintain the overall health. It can help for someone to meet their daily requirements for essential nutrients. So, for example, if someone is deficient in, for example, iron, they're able to take iron supplement to be able to ensure that they're actually getting enough of that specific mineral in their diet. So some statistics. Globally, the dietary supplement marketplace is actually valued at more than 130 billion US dollars. Um, in addition to that, the use of dietary supplements in the United States is approximately half of US adults are actually taking at least one form of dietary supplement, and one-third of children as well. And on the left side of the slide, I actually have a histogram that shows the breakdown of the percentage of adults from different age groups divided between men and women of how many actually use dietary supplements. In addition, 12% of adults who use dietary supplements reported taking at least 5 different products. So with that, there's an increase of reactions between dietary supplements and medications. All right, so there are some risks that one should be aware of when taking dietary supplements. The first one, as I previously mentioned, the interaction with other medications and supplements. For example, if someone is on a vitamin K supplement and they're taking warfarin, which is an anticoagulant medication, it will affect its effectiveness of that drug, which is a blood thinning medication. There are also supplements can actually interfere with lab results and lab tests. So, for example, biotin can actually affect the tests like the troponin levels that are used to diagnose heart attacks. And additionally, taking too much of a supplement can cause toxicity because there is no actual, you don't need a prescription to be able to purchase supplements. A consumer can actually be at risk for toxicity levels of taking high doses or combining multiple different ones. So current regulation, at the moment, the FDA does not have any authority to approve dietary supplements for safety and effectiveness. So before it is actually introduced to the market and to consumers, the FDA does not have the authority to actually oversee it. Companies do not have to get it approved. And the only time that the FDA does step in is if a dietary supplement is found to be unsafe due to a number of complaints. That's when the FDA is able to step in. They're able to ask the company to voluntarily recall the product or take action to remove a dangerous product off the market. So because of that, FDA should regulate dietary supplements for the safety of the consumers to be able to reduce the supplement use. And also because of the limitations of these existing regulations that I just mentioned, and as well as to improve the quality and the efficacy of these dietary supplements. So how can the FDA do this? So my supplement regulation plan is first a pre-market approval. Companies need to provide safety and efficacy evidence to the FDA by providing rigorous clinical trials, to randomized control trials, as well as to ensure that they're doing in vitro studies as well. Through third-party testing, to be able to get certified through a different company to prevent any biases from the own company conducting their own research, and then to also introduce a product registration system with strict compositional guidelines to ensure that what is being said that's in the dietary supplement is actually what's being provided to the consumer. For manufacturer registration and licensing, to implement mandated manufacturer registration and licensing and be able to have this available to the consumer, as well as inspection of those facilities where these dietary supplements are being made. Third is for the internet, so improvement of regulation and marketing of dietary supplements that are sold online, specifically stricter online marketplace oversights in order to protect vulnerable populations such as teenagers, as well as there is a rise of influencers and discounts online that can motivate or influence consumers to purchase dietary supplements without knowing exactly what they're purchasing. In terms of education, healthcare professionals should be taught on how to be able to advise patients effectively when it comes to dietary supplements, explaining to them what exactly they're deficient in, and for the healthcare system to be able to provide, or health insurance to provide regular blood work to see what they're deficient in. Store associates at stores such as like these supplement stores should be also educated to avoid providing misinformation or recommending of certain supplements, and then also to provide a website or somewhere where consumers can find the certified and licensed dietary supplements for consumers. And then last but not least, the research. So provide more research funding for constant research, the long-term usage of supplements, as well as in vitro studies and randomized control trials that are needed to demonstrate efficacy and increase transparency for the consumer. And that was my research proposal, and these are my references. Thank you.